Look, I'm sorry I haven't had time to take my flying gear off, but I've been quite busy up there at the moment, shooting down a few Germans, protecting the country, you know what it's like. But anyway, I'm here now, and this is part 2 of depression. Last week, we went through part 1 of depression, which was, what is it? This week, I want to tell you, how does a doctor diagnose depression? So if you're feeling a bit low and you go and see the doctor, how do they actually diagnose it? Well, I think it's important to understand when a doctor makes a diagnosis, they do it through a process. That's the way they're trained. When you turn up with a symptom, the first thing they want to know is, what's the history of the problem? How long have you had it for? What is it? Once they've got a full handle on what the symptom is, they then go on and do an examination, you know, feel your tummy, look in your eyes and stuff like that. They may then do a few tests, and then they put the history findings, the examination findings, and the investigation findings together to make an initial diagnosis. They may have it wrong, but they make an initial diagnosis and then work through from there. So look, let's say if we take depression, how does then a doctor diagnose depression? Okay, so how then, when you turn up in the doctor's surgery, feeling a bit low, a bit depressed, is that doctor going to diagnose you with depression? You may not have it, but how are they going to go about it? Well, to start with, when you turn up to a doctor and you start talking about this sort of stuff, it's not a bad idea to have some friends and family along, because they can back up what you say and maybe even add more to it that you never really realised. So having family and friends along when you're talking to the doctor not only supports you, but it gives the doctor a much bigger picture. So if you're feeling low and you're going to see the doc, make sure you take all your friends and family, heaps of them. So there you are, stuffed in the doctor's room, you and your friends and family. And what the doctor wants to know then, okay, Bill or Joe or Susan, what are your symptoms, you know? And they'll be looking for those symptoms of depression that I mentioned last week in part 1, which you can have a quick look on YouTube again if you want to have a look. But they're the emotional ones of the low, flat mood, the brain's slowing, where you're not thinking as fast as you normally do, and your memory's a bit shot as well. And then there's the physical symptoms of depression, which are just like the brain, everything's just slowed down. You don't have the sexual drive, you don't have the appetite, and you might get a bit constipated as well. You're not sleeping, waking up early in the morning. So once the doctor's got a handle, okay, these are your symptoms, they want to know, how long have you had them for? Has it just been for a day? Well, big deal. Or has this been going on for months and months and it's getting worse? They'll also want to know, as part of the history, is there an obvious cause to it? A lot of depression is reactive to some situation. Like, for example, you might have just had a baby, and a lot of people get depressed after having a baby. Your dog's just got run over. Your mum's died. So there's all these reasons which, like, a lot of people get low about, but you just got a bit worse than everybody else, so it's called reactive depression. So it's important in the history. What's even more important is there no explanation for this at all? It's just slowly happened. And this often is where it comes into a family history of depression. For some reason or other, some families are just predisposed to depression. They've got low chemical levels of certain neurotransmitters in their scon, and they're predisposed to it. Endogenous depression, the doctors call it. So that's part of the history. Is there no reason for it? Then the doc might want to know, have you ever been depressed before? Have you ever tried to take your life before? You know, like some people have, you know, and it's pretty scary for them. So it's important you come clean with the doc. And the doctor will also want to know how much you drink, like you're drinking too much, what's the quantity, you're smoking any pot or taking any drugs which may give you a lift, but then may give you a real downer afterwards. That's called the social history. So, you know, there's a little bit involved there, and the doctor will ask you, and then maybe look at the family, and then overall everyone will start to get a pretty good picture or history of what's actually going on here. You see what I mean? After the history's done, the doctor will then say, well, look, I really want to do a physical examination, because there's some physical causes to depression. So, you know, the old doc might take you over to the bed there, check your blood pressure, look in your eyes, listen to your heart, feel your thyroid gland, and do a physical exam. The doctor will have already done a mental status examination. The doctor would have been watching you and listening to what you're saying. Are you well dressed? You know, because often people who are depressed are sort of scruffy and lots of whiskers and don't really give a damn about their appearance, and they appear depressed and weepy, you know, crying about silly little things which you normally wouldn't cry about. So the physical examination's done, the mental status one, the doctor's got an idea what they think about your mental status, and you know, they've done a physical one, checking all your body, and then they'll have a think. You know, we've got then the history of the problem and everything around it. We've then got the physical examination, the mental status. They may want then to go on and do some blood tests to look for certain illnesses that can bring on depression, like low thyroid or anemia. And they may even want to go on and do a few brain scans or chest x-rays. Like some people can present with depression when they've actually got a brain tumour. And a good doctor will have actually thought about this sort of stuff. When you throw it all together, they will put all this together, and then between you and them, they'll say, look, you'll say, they'll say, we'll all say, look, there's no question you're depressed. This is the most likely cause, and really, how's that sound? And you know, if you've got any brains, you'll think, well, gee, the doctor's right here, and let's do something about it. So you've got the diagnosis. You may not be depressed, but if you've got that fairly clear diagnosis that you are, then you move on to doing something about it, and that's next week's Healthy Bastards Health Tip: how do you treat depression? So thanks, folks. This is a tough one to get across, depression, because it's serious. A lot of people get depressed and end up topping themselves when they don't need to. They haven't reached for help. So I've got to tread carefully on this one. So all I can say is thanks very much for listening, and do try and spread this Healthy Bastards Health Tip. Get there on YouTube, tell your friends about it, and I look forward to seeing you next week. I must rush. I can hear another aeroplane up there, and obviously I've got to have to do some air-to-air combat and sort it out.